I feel a little bit like Ronnie Corbett sitting here in the chair, for those of you old enough to remember. I have to say, I have learnt so much this morning. It's been a brilliant morning so far. Rachel, I can't thank you enough. You've taught me so much about mitochondria that I should have known but didn't. But that's because I'm the kind of hands-on practical person rather than the theoretical researcher that Rachel is. What I do know about chronic fatigue and ME is that there ain't enough doctors to go round. And the person who's going to be most important in your recovery is going to be yourself. And my view is I have to give you, as I call it, the rules of the game and the tools of the trade so you can fix yourself. And nobody's going to be better incentivized to do it. And nobody's going to be better able to monitor yourself from hour to hour, from day to day, in order to allow recovery. And I've been thrashing away at this for about 40 years, as many of you know. It shows how old I am. And I've explored many avenues and many dead ends. And I promise you, I don't know all the answers, but I do know the basic workup that we must all do to give ourselves a best chance of recovering from chronic fatigue and ME, B, living our life to its full potential and enjoying things, and C, avoiding all the nasty killers of the modern age, which is diabetes, dementia, heart disease, and cancer. So what I'm going to talk about today is not just the starting point to treat patients with chronic fatigue syndrome and ME, but also the starting point for all of us to optimize our good health. And if many people are here, I know, as practitioners, and if you are going to enthuse your patients to do these regimes, you have to do them yourself. And thereby you work out the nitty-gritty of what it means from day to day. And as some of you know, I run EcoMed weekends for my dear friends, and we spend more time talking about food and diet than all other subjects put together. So, again, if you're going to empower your patients to do the difficult interventions that are necessary, they have to understand the intellectual imperatives, you know, the underlying mechanisms that are driving those needs. And so let's just briefly start around. Oops, the daisy have gone wrong already. Okay, there we go. Okay, so the key point to remember about chronic fatigue syndrome and ME, they are not diagnoses, they are clinical pictures. Now, a diagnosis implies that you know and understand the underlying mechanism. Many diagnoses are retrospective. You can't make that diagnosis truly until the patient is cured by those particular interventions. And so what we start off with is a differential diagnosis. And the clinical picture of chronic fatigue syndrome is characterized by poor energy delivery mechanisms. And the clinical picture of ME is characterized by chronic fatigue syndrome, you know, and poor energy and inflammation. And inflammation, as I call it, kicks an immunological hole in the energy bucket and causes lots of symptoms in its own right. So fibromyalgia, for example, is also a clinical picture with several possible causes. Rachel discussed some this morning. You know, if you've got poor energy delivery, there is an early switch into lactic acid metabolism, and lactic acid is very painful. You know, it stops athletes winning gold medals, and it will stop chronic fatigue syndrome patients in their path. And the point here is to generate lactic acid anaerobically, okay, gives you 2 molecules of ATP. But if you're going to convert that lactic acid back to pyruvate via the Cori cycle, that costs 6 molecules of ATP. So it's like borrowing energy from a loan shark. You know, it's very bad news. And this is why the starting point and the most boring bit is, you know, patients absolutely must pace their activities when they simply don't have the energy to do anything other than. Okay, other mechanisms of fibromyalgia, magnesium deficiency, and we can talk about that. And to correct magnesium, yes, you need a good dose, but you also need vitamin D. Without vitamin D, you cannot absorb magnesium. And what I found is that by giving magnesium routinely with good dose of vitamin D, the need for magnesium by injection has dropped significantly. Allergy to foods can certainly cause muscle pain. Muscles can react allergically to foods and substances just like any other department of the body can. Muscles can only react in one way, which is with spasm, and muscle spasm is extremely painful. It's one of the worst pains that you can experience. Allergy to microbes in the fermenting gut, I'll come on to that, but I think that is a major driver of pathology. Well, let's do it now. The point here is that, you know, we are taught at medical school, yes, The gut is full of bacteria and yeast and whatever, and there they remain. And we now know that's not true. These microbes very easily get into the bloodstream, and that is called bacterial translocation. Now, if these are friendly microbes that the immune system has been looking at for billions of years, it says, oh, that's okay, these are the friendly guys, we can ignore them. But if they are relatively recent from an evolutionary perspective, if they are coming from the upper fermenting gut, the immune system doesn't recognize them and will drive inflammation wherever those microbes end up. And I suspect many pathologies, from vascular pathologies like temporal arteritis, polymyalgia rheumatica, intrinsic asthma, yes, fibromyalgia, venous ulcers, idiopathic edema, urticaria. I think many of those conditions are driven by allergy to microbes in the fermenting gut. Oh, and irritable bladders. So many irritable bladders. I'm quite sure this is the mechanism. And then hypothyroidism. If the thyroid is underactive, that too can cause muscle pain in its own right. So mitochondrial disorders manifest in the short term with poor energy delivery mechanisms. You know, that's pretty obvious. And of course, there are a multiplicity of possible symptoms, but you know, mitochondria are not the only players. And the analogy I love to use is the car analogy. I get it and my patients get it. And for your car to go, which is your body, you need the right fuel in the tank. You've got to have the mitochondrial engine, and then the control mechanisms, the thyroid accelerator pedal and the adrenal gearbox. And the key point here is that the thyroid and the adrenal glands manifest through their activity on mitochondria, largely speaking. Okay, so as I say, this is why these conditions are so badly treated, because we've got so used to one symptom, you know, one drug, you know, one outcome approach to medicine, which is now unscientific. It's not, well, we call it conventional, but it is unscientific, illogical medicine that has to go out of date. And what we need is a new group of therapists who are looking at things from first principles and asking the question why and looking at disease causation. That's one of my books I produced that's all about it. Okay, now the key point to remember about fatigue is it is an essential symptom. Now, we all have a bucket of energy that we can spend in a day. And if you're lucky and you've got a large bucket of energy, much can be done. But the point is, if we spend more energy than the body can generate, then we will die for the very simple reason we don't have the energy to function physically, we don't have the energy to function mentally, and the immune system can't function either. So we have to ask, well, so how does the body stop us from overspending? You know, how does it achieve that? And the answer is, it gives us nasty symptoms. And, you know, those symptoms are so severe that they make us feel ill and they give us a miserable life, but they do actually stop us from dying. So the point here is that the symptoms are our roadmap for recovery. And when patients come on lots of symptom suppressing medication, it's like, you know, a detective coming on a crime scene that's been trampled all over by a load of idiots. You know, the clues have gone. And that's not helpful from the point of view of diagnosis. We have to go right back to square one and get people off their symptom suppressing medication to really, you know where we're going. Not that I like people having pain, believe you me, you know, it's a nasty symptom, but you know, symptom suppression is not the answer to chronic fatigue syndrome at ME. So these are the sort of symptoms that we see when we have poor energy delivery to the body, to the brain, and so on. And the obvious, you know, physical symptoms of poor energy to the body are obviously physical fatigue and poor stamina. But what makes fatigue pathological is the delayed fatigue, the post-exertional malaise. So by the end of today, yes, I will be tired. I will be normally tired. I've had a jolly good time and I'll be traveling home and I'll have a good night's sleep. And tomorrow morning, I should be as right as rain. But the chronic fatigue syndrome patients, the ME patients, if they spend more than their energy package permits, they develop delayed fatigue and they can be seriously ill, unwell, inflamed for some days subsequent. And that is the basis of pacing. If you are, it's like an athlete being in a state of total overtraining. And as I'm sure you're aware, you know, the key to training an athlete is there's a perfect amount of training that can be done. I remember reading in New Scientist a lovely story of a 70-year-old guy whose ambition was to run a marathon within 4 hours. And he trained and he trained and he trained and he trained. He couldn't quite do it. He was then laid off for a month because he had an ankle injury. He then went out, and when he ran his marathon, he easily got within his 4-hour window. And the point was, he put himself into a state of, constant overtraining on the grounds that more is better. So again, exactly the same rules apply. I mean, we're all on the same spectrum. There's the chronic, the same energy spectrum. So the chronic fatigue syndrome patients are down there, I'm in the middle, and the elite athletes are at the top. And the same principles that apply to improving energy delivery in the fatigue syndrome patients also apply to the elite athletes. And overtraining, does not get the result. So look for the delayed fatigue, and that's overtraining. That's spending too much energy. Okay, poor energy delivery to the brain. The brain weighs 2% of body weight, but consumes massive amounts of energy. 20% of all the energy generated in the body goes to keeping the brain going. And if energy delivery to the brain is impaired, then the brain will go slow. Foggy brain, can't multitask, cannot concentrate, cannot problem solve. Many of my fatigue syndrome patients say, they can read a book, but, they've lost the plot, a couple of chapters in. They watch a film on the television and they suddenly realize they have no idea what's gone before. They are describing an early dementia. And of course, they're all terrified that they're going demented. The answer is they are. But the good news is you put in place all these interventions, and just like Dale Bredesen reverses cognitive decline in patients with pathological dementias, the ME patients can reverse their mental decline with these simple nutritional interventions, which are now well established. And then, of course, the brain gives us symptoms to stop us from spending energy. And I have to say, I'm always astonished by how undepressed my chronic fatigue syndrome patients are. They should be, blooming miserable, but depression is the symptom that the brain gives you to stop you spending energy. Because when you're depressed, you don't want to socialize. You don't want to go out and be jolly and funny and witty and all those things. And you certainly haven't got the energy to. So, being antisocial and being depressed, is an inevitable part of the condition. I suspect that sensation of feeling stressed is the symptom that the brain gives us when it knows it doesn't have the energy to deal with demand. If I could give my patients infinite energy, they could earn lots of money, sort out the problems of the house, raise 4 kids, go running and go training, and and feel wonderful. But if they haven't got the energy, they simply cannot do that. And then, of course, poor energy delivery to the immune system. I mean, the immune system I think of as a mobile brain. The immune system does everything that the brain can do. It's throughout the body. It's intelligent, it's decision-making, it's communicative, it's fighting infection. And without a good immune system, we just wouldn't be here. But that, too, is highly demanding of energy. And, you give any person flu, and what happens? They're bedbound. Why? Because all the energy of the body is being diverted to fight that wretched infection. And one of the things I did as a GP, I quickly worked out, if I had somebody who came to see me with flu, I automatically used to give them a sick note for 2 weeks and say, and go to bed, and run a fever, and don't take paracetamol, and don't take aspirin or night nurse or day nurse, all symptom suppressing medications that would allow that virus or that microbe to win the arms race. And okay, I might have got it wrong in 19 cases out of 20, but if I prevented 1 in 20 patients progressing to a chronic fatigue syndrome, then I was doing, the population a great service. Okay, so to improve energy delivery mechanisms, we have to address all these players: the dart, the engine, the accelerator pedal, and the adrenal gland. And what I also know now is that we have to do things in the right order. And in my early days, and believe you me, I'm still on a very steep and very fast learning curve, but in my early days, I used to give people a great shopping list of things to do. This supplement, this diet, but. And people understandably would cherry pick and do the easy things first. And the hardest thing to do, and the most important thing to do, is the wretched diet. And that's where it all starts at. And the reason for this is here. You've got to start with the PK diet, because as we've heard from Rachel, the preferred fuel of mitochondria are ketones, are fats. They cause the least damage to the mitochondria, and mitochondria work most efficiently with those. The second reason for doing a ketogenic diet is because people who have been eating carbohydrates for decades, and guess what? They all are, all babies are raised on carbohydrates, despite being born in ketosis, despite running on ketones, all babies and children are raised on carbohydrates. And and of course, we eat carbohydrates because they're addictive. And if you're constantly eating carbohydrates, you will have an upper fermenting gut. And the chance of that increases even more so with age. And if your upper gut is full of bacteria and full of yeast, then when you start taking nutritional supplements, you're just feeding the bugs and encouraging their overgrowth in the upper gut. So, it's just the waste of expensive supplements. So the first thing we have to do is treat the upper fermenting gut. And how do we do that? Well, you starve the little wretches out with a ketogenic diet, so you don't feed them the sugars and carbohydrates, which they love to ferment. And then you kill them with vitamin C. And vitamin C is one of my favorite multitasking tools. It does lots of fabulous jobs. But the first job we're asking it to do is it's going to kill those fermenting microbes in the upper gut. If some patients don't tolerate vitamin C or don't take too much of it, another very useful intervention is good old mastica gum. And for some people, that will clear Helicobacter pylori. It's that effective at cleaning up the upper gut. It's cheap, it's cheerful, 350 milligrams, chewed 3 times daily, 90 minutes away from food. Again, that's a useful addition for the upper fermenting gut. So once you've got a gut that's in a fit state to absorb, then you can start giving it some supplements, because guess what? Everybody is deficient. And in the early days of treating patients with fatigue syndromes, I used to do lots of nutritional tests. I no longer do. I'm so sorry about that, Mark. I mean, it's very bad, but yeah, okay. Because I know what the results are going to be. And there is no point, asking your patients who cannot work, who are surviving on benefits or next to nothing, to spend money on expensive tests when you know what the answers are going to be. So I know they're going to be deficient. And the simple reason for that is, well, first of all, they've been malabsorbing for years. Secondly, we know a high carbohydrate diet drains the body of micronutrients. But the most pressing reason, perhaps, is modern agriculture. We have a one-way cycle of minerals from the soil into plants, into animals, into humans, and we throw them away. So guess what? We're all going to be mineral deficient. And if the plants are mineral deficient, they can't make the vitamins. So guess what? We're all going to be vitamin deficient too. So I have a basic package of supplements which I take, which I think I come on to. And then once you've got that right, then you can start to correct the mitochondrial dysfunction. And, as I mentioned, having got the mitochondrial dysfunction right, you then move on to the control mechanisms, because they manifest through their actions on mitochondria. So you don't see somebody at a first appointment and start messing around with their thyroid, because thyroid hormones manifest through their effect on mitochondria. So that's the protocol, that's the order of action, which is just as important as the action itself. So this is the fuel in the tank, as I call it. And when people say to me, well, why? What's so special about the PK diet? The answer to that is, well, that's what humans have been eating for some hundreds of thousands of years. That is what our whole gut is adapted to deal with, and that is what our mitochondria function best with. Because it's and it's PK for 2 reasons. Ketone, obviously, low carbohydrate ketone. Paleo, because gluten is such a dangerous substance. It's implicated in so many disease processes. And at a recent conference I went to, the consensus of that conference was that, well, gluten grains really should be animal feed only. It's no longer safe for humans to consume gluten grains. Dairy products, again, very dangerous foods. Dairy products, evolution intended for young mammals. If young mammals don't grow very quickly, then they get eaten by saber-toothed tigers. And all dairy products contain growth promoters. And if you want to avoid cancer, you should not be eating growth promoters. It's the protein in there that is the problem. Heart disease, very dear colleague of ours, Dr. David Fried, together with Margaret Moss, produced a wonderful paper called The Cow and the Coronary. And the essence, and what they did is they looked at dairy consumption throughout Europe and risk of heart disease, and there was a direct correlation between the two. The more dairy products, the more arterial disease. So they then broke it down into, well, which bit's the bad bit? And the most dangerous fluid you can drink is semi-skimmed milk, because it's the milk protein that makes for sticky blood. And on top of that, the proportion of calcium and magnesium in dairy products is far too high. 10 parts calcium to 1 part magnesium. And they compete with each other for absorption. So just consuming lots of dairy products will induce a magnesium deficiency. And don't think dairy products are a good source of vitamin D. They're not, because cows are living indoors these days. They do not get the sunshine. So, you know, dairy products, you know, are not good for our arteries. Again, positive association with autoimmunity, almost certainly that's a milk protein factor. Osteoporosis. Consuming dairy products is a major risk factor for osteoporosis. And a paper in the BMJ to demonstrate that. But yeah, but what are poor patients told? You know, it's, oh yes, go and have lots of, you know, milk and dairy products. It's going to be good for your bones. I don't think so. It actually increases osteoporosis. One of my most hated drugs are the proton pump inhibitors, which induce hypochlorhydria, low stomach acid, and therefore you malabsorb all your minerals. But I haven't come across a single patient who's been told that by taking PPIs, they will greatly increase their risk of osteoporosis. The upper fermenting gut, because of course milk contains sugar and that will be happily fermented, and even the lactose-free milk, that's no good either, because that just gets broken down into other sugars. And the only safe dairy product is butter. I absolutely love butter. Sadly, I'm very allergic to it and can't have it, but if you're absolutely sure you're not allergic to it, then butter is a fantastic fat. Okay, so having got onto the diet, what is very helpful is to use is to then measure to see if you've done it well enough. So the details of various recipes are in the PK cookbook. Okay, so this is the basic pack. So I'm going to assume now that you've done the PK diet perfectly. And usually when it comes to question diets, there are 1,000,001 questions on what can I eat. But the key is to test. Because if you test, then you know you've arrived. So then the basic package, supplements I like people to have, good multivitamin to replace, you know, the vitamins that are no longer present in our food, a good mineral, and I put together a mineral preparation, which I called Sunshine Salt. It's got all minerals that's permitted, you know, in a form that's soluble, in the correct proportion, and with a nice dose of salt, because your requirement for salt will increase on a ketogenic diet. And then the vitamin C. And the bare minimum is ascorbic acid, 5 grams in your daily bottle of water, little and often through the day. And if you find you don't tolerate the ascorbic acid, then put some magnesium carbonate in there. Cheap and cheerful. The proportion is 2 parts ascorbic acid to 1 part magnesium carbonate by weight, gives you a neutral solution, and also a nice little dose of magnesium in addition. And so now we've got to the stage when we've sorted out the keto diet. We've got the perfect fuel for our mitochondria. We've got rid of our upper fermenting gut, so we are in a state that we can absorb. So now we can start to fix our mitochondria. Okay, and only now can we start fixing our mitochondria. And the mitochondria may be going slow for a variety of reasons. They may be fed the wrong fuel. You know, as you've heard, mitochondria can burn sugar, but it causes terrible damage in mitochondria. My guess is that the reason they burn sugar is to get rid of the wretched stuff. You know, yes, sugars in the diet do have a role to play. You know, we do need sugars for the raw material to make the 5-carbon sugar, which is the raw material to make DNA, RNA, and ATP. And we use a certain amount of sugar for the business of detoxification. That's called glucuronidation, but we don't need much of it. And if we have much more of that, if there's too much sugar and carbs in the diet, the body gets rid of it as quickly as it possibly can by burning it off. Rachel mentioned earlier that mitochondria will always burn sugar in preference to all that. And I think that's a technique to get rid of the wretched stuff. Okay, so we've got to have the right fuel. And then mitochondria can go slow because they are deficient in essential micronutrients. And we've talked about many of them this morning. And magnesium is absolutely crucial. Coenzyme Q10, arguably, I was just saying Shidi earlier, arguably we should be calling that a vitamin because we can't synthesize enough of it ourselves. And I'm quite sure this is one of the reasons that being a vegan or a vegetarian is a major risk factor for chronic fatigue syndrome, because you just can't eat, you just can't consume sufficient CoQ10. Again, acetyl L-carnitine, essential. I think of acetyl L-carnitine as the nozzle of the fuel delivery system that gets the fuel from the cell cytosol into the mitochondria where it's needed. It delivers fuel. It's called L-carnitine because it comes from meat, carnitine, carnos, meat, carnivores. Again, when I test, the vegetarians and the vegans almost invariably are going to be deficient in carnitine and CoQ10. And then mitochondria may be going slow because they're blocked by something. And again, Rachel thankfully covered that, the pesticides, the volatile organic compounds, the day-to-day chemicals that people pour into their cells in the name of looking beautiful. I don't use cosmetics, you'll be pleased to hear. It's just ugly me sitting in front of you. That's what my girls tell me anyway. So there are lots of toxins out there that can get into and inhibit mitochondria. And then we have the control mechanisms. Is lunch ready, Damien?
No, the opposite. You've got to finish your whole talk now.
Oh, okay.
And then we're having lunch.
Oh, well,
okay.
That's absolutely fine because good Lord, no, I'm running on ketones. And I can prove it. Well, what that doesn't mean is I don't get the 2 o'clock slot when everybody's kind of falling off to sleep. Okay. So, having thought, then we have to look at the control mechanisms, and then we have to look at service and repair. Now, again, using the car analogy, my ancient truck which chugs me around Radnorshire needs servicing once every 6 months, but our bodies need servicing every single day, and that occurs during sleep. In fact, all life forms, right down to bacteria, have to shut down their biochemistry for a window of time to allow healing and repair. And amazing creatures like dolphins do amazing things, like they make one half of their brain sleep because they can't sleep completely for obvious reasons. The one half of their brain sleeps while they swim around on the other half, and then the other, the other half of their brain sleeps, but they too have to sleep for efficient healing and repair. Okay. Now, we know these interventions work because we have a scientific paper proving such. Now, as you all know, I've had an intellectual love affair with Mark's father for some decades now. Thank you, John McLaren Howard, who, as you know, has been such a wonderful and innovative biochemist. He was a founder member of Biolab in the early 1980s. Funnily enough, a little bit of history here, he lived in Welwyn, where I was born and bred, and he was a patient of my father's. So John McLaren Howard developed a test for mitochondrial dysfunction in the 90s and then the 2000s. I mean, as all medical students know, biochemistry is a nasty exam you have to pass at second MB. You achieve that by sitting up all night with chocolate biscuits and coffee, swatting up mitochondrial biochemistry. You regurgitate it onto the examination paper the next morning and pray that you've done enough to pass. And the reason why you do it that way is because in the 1970s, mitochondria didn't seem to have any clinical application whatsoever. Nobody knew what they did, it set some biochemical wizards. And as I said, they had no apparent clinical implication. And now, as we've learned from Rachel, they are implicated in almost any pathology that you care to mention. But John developed a mitochondrial function test, and we produced a paper I think the first one was 2009, where we demonstrated that those, by this time I'd got a cohort of patients that I'd done everything that I knew to do, the diet, the supplements, the thyroid stuff, and they weren't getting better. And we took 71 of those patients. They came see me one at a time. With those patients, I agreed a clinical fatigue score. I then sent the bloods down to John, who did the mitochondrial function tests. He sent the results to a third-party, Professor Norman Booth, who is the Department of Physics at Mansfield College, Oxford. He had an interest because his wife has ME, and Norman did the number crunching. So I was blinded because I didn't know what the biochemistry was. John was blinded because he didn't know what the clinical picture was, and Norman Booth worked out the rest. And that first paper showed a direct relationship. Those patients who were the most fatigued had the worst mitochondrial function, and vice versa. There was almost a straight line relationship between the two. So having done that, we then had to ask the question, well, what happens when we put these mitochondrial package of treatments in place? Now, I didn't have the money to do a full study. We just had to do it by dint of an audit. So as patients turned up to me and said, I'd like to have a repeat test, then of course I did that, and they were included with their permission, obviously, in the study. So this was an entirely patient-funded study. Initially, I wanted to call it a citizen's paper. And bless them, these lovely people were very happy to give their information. And this is the results of, this was actually the third paper that was published in 2013. And along the bottom, the identification of the patients, and then each patient has 2 columns, and they both pertain to their mitochondrial energy score. And as you can see, the purple column on the left was the mitochondrial energy score that we did first time, and the yellow column on the right was and what happened at follow-up. Now we had 34 patients in total, and the 4 on the rightmost side of the screen, they were 4 patients who, for whatever reason, didn't put in place the interventions, did not take the mitochondrial package, did not do the detox regimes that have been recommended. The reason why the results of this study were accepted for publication is because the statistics were so astonishing. Again, we did it in the same way, we did it blinded. You know, the patient came to me, agreed the score. The results went to John McLaren Howard, who did the test, and the 2 results went blind to Norman Booth, because every single one of the 34 patients, of the 30 patients who put the regimes in place, in all cases, they improved their mitochondrial function. And the 4 patients who, for whatever reason, chose not to, in all cases, their mitochondrial function got worse. Now, the important part about this is, at present, we do not have available this test in this country, but it doesn't matter. We know the regimes work reliably well. You just got to do it. So, cripes, I've jumped around, and that's what I do all the time, I'm afraid. The correct fuel for mitochondria are ketones. And Rachel has said much of this. Rachel earlier mentioned one of my favorite books, which is Power, Sex and Suicide by Professor Nick Lane. Another one of my favorite books that was recommended to me by our darling colleague, John Mansfield, was called The Sinatra Solution. I can't think about John without bursting into tears. If you want to learn about mitochondrial biochemistry, Stephen Sinatra, The Sinatra Solution, is a lovely walk through the whole of biochemistry. And he wrote the book because he was a completely conventional cardiologist working in America. And from using the drugs, the pacemakers, the surgery, he switched over entirely to nutritional medicine because he found he was able to reverse heart disease using ketogenic diet and the mitochondrial package of supplements with fabulous results. Not the only doctor, Dr. Gabriella Segura, Italian cardiologist, went through the same evolution. And her statement, in short, let fat be thy medicine and medicine be thy fat, was her mantra. Okay, so the first thing that you're all going to do, I know, as soon as you get home, if you've not already joined me in it, is the path to a ketogenic diet. Now, a very, very helpful tool is measure. You cannot beat the science because people love to tell me, everything that they have for breakfast, and every last food, and it's very time consuming. And I say to them, stop. I don't want to hear what you want. I want to see the results of your tests. I'm a rude, vicious, miserable, short-tempered therapist because I can sort the dietary issues out very, very quickly. And the important thing is by measuring, you know you've achieved, you have arrived. Because the key point to remember is, as Rachel mentioned, mitochondria will always burn sugar in preference to anything else to get rid of the nasty, dangerous, toxic stuff. So if you are in ketosis, any amount will do. Because people say to me, oh, I'm only blowing 1 part per million. Oh, I'm blowing 5 parts. It doesn't matter. Any amount will do. Now, there are 3 ketones that are produced as a result of beta oxidation of fat. Now, beta-hydroxybutyric acid is a major fuel, and that can be measured in the bloodstream. Now, that is far and away the best test. It's by far and away the most accurate. But to measure that, first of all, you have to prick your finger and get a drop of blood. And guess what? I'm a wimp. Am I going to do that? No. Secondly, the strips are rather expensive. They cost £1 each. I'm mean. Am I going to pay that? No, I'm not. So that's so if you really want to know, then that's the test to do. The next possibility is to measure ketones in your urine, and that's a very easy test to do. You just pee on the sticks, and if they go from pink to purple, you're in ketosis. But what people find with time is that as the body gets better at matching energy delivery from fat into requirements, very often the urine tests will go negative. So, once you've been well established, they can be a little bit misleading. And these days I tend to use breath testing because it's dead easy. You can get a ketone breath meter for about 40 quid, and it takes 20 seconds to warm up. You can blow into it and you can immediately tell if you're blowing 1 part per million, 8 parts per million, 10 parts per million. It doesn't matter. Any amount will do. And then you give yourself a big pat on the back. You have arrived. And when you come in for your follow-up appointment, you can look me in the eye and say, I'm in ketosis. Okay. So now many people have criticized the ketone breath test. They say it's not accurate. Now, it's using the similar technology as that is using for breath testing that the police use. It's a super sensitive test. It's measuring parts per million, and things can make it go wrong. And you can get false positives and you can get false negative results. So if I have a sip of coffee and blow into my ketone breath meter, it's going to go negative. I've tried it so many times, it just doesn't like that. If I have a glass of wine, I will get a massive positive. Alcohol, wipes, if you're somebody who likes to clean things with alcohol, and I'm not, I have to say, that will give you a false positive. Some cleaning agents will give you a false positive. But what I do know is a major upper fermenting gut microbe is yeast. Yeast will ferment sugar into alcohol. And so those people who have an upper fermenting gut and will blow positive and triumph and say, there you go, it's a useless breath meter, isn't it? So you've got to use these breath meters with a certain amount of respect. And once you get to know your breath meter, you'll know what it is and is not capable of. So be nice to yourself. The next thing is you have to make sure that your patient is eating sufficient calories. And so many people, undereat in a misguided attempt to lose weight. That's the worst possible thing you can lose to try to lose weight. Because if you're not fueling your body, you're going to be fatigued, you're going to be foggy brain, you're going to be miserable, you're going to be depressed, and so on. So do calculate your energy need. And that is the formula. I'm no mathematician, so it's much easier to get it up on the internet, and you just put in your weight, your age, and your activity, and that will tell you how many calories you need. And I am shocked by how some of my patients, especially very few, they seem to be living on absolutely nothing. They're running on 1,000 or 1,200 calories, and just don't seem to realize that that's quite likely a major cause of their fatigue. And then they're terrified to eat fat because, oh, they know fat's very bad for you, it raises your cholesterol, and all that sort of rubbish. So do just a back of the envelope calculation to make sure you're eating somewhere near a decent number of calories. And then make sure you've got the correct amount of protein. Now, I don't know if I read a lovely book recently called Eat Like the Animals. And it picks up a subject called protein leverage. And the work was initially done on insects, where they fed insects either a low protein, a normal protein, or a high protein diet. And what they found is those insects continued to eat until their protein requirement had been satisfied, and then they stopped eating. So those insects on a low protein diet ate and ate and ate and ate and ate and ate, and in doing so they overate and got fat. By contrast, those insects eating a high protein diet, their protein requirement was very quickly satisfied, and they stopped eating and they got skinny. So do calculate your protein, and that test was then repeated in other insects, small mammals, large mammals, and the same principle applied across the animal kingdom. You know, our appetites is very much determined by our protein intake. So again, make sure you eat enough sufficient protein. And that's how you calculate it. Again, you can calculate it quite easily. Work it out from how many calories you need. So that's my calorie requirement, and that's how I work out how much protein I need. And what you notice is that your protein requirement increases as you get older. So I'm 60, 65, so my protein requirement is 18% of the daily energy, and well, of the figures there. So again, as we get older, we should be eating more protein. Okay. And then fiber, again, is very important. You know, people say to me, oh, it's a high protein diet. No, it isn't a high protein diet. It's a diet which is high in fat and in fiber. You know, so how much fiber do you need? Well, you can read and so can I. But essentially, I like to say to my patients, your number 2 should become number 4s. And if you are effortlessly producing a daily turd that's about the size and shape and smoothness of a cucumber, you've arrived. And there's lots of fabulous epidemiology and research demonstrating that fiber is an essential part of our diet. And it's not just to prevent colorectal cancer, and it's not just to prevent heart disease. You know, if you have a healthy microbiome, and guess what, the large bowel, the lower bowel, now that's where fermentation takes place. We should be fermenting fiber in the large bowel in order to nourish our body. And my guess is that in the large bowel, we have a predator-prey relationship, just like we do in the rest of the animal world. And there are specific microbes in the large bowel that are specific to certain foods. And I'm quite sure in the large bowel, you know, there is you know, a watercress-loving microbe and an anchovy, you know, loving microbe, not anchovy, an artichoke-loving microbe, The point being, we don't know much about the microbiome, I have to say. We know it's important, but one of the things that we do know is that the more diverse the microbiome, the greater the diversity, the more number of different microbes we have, the healthier we are. And my guess is that simply reflects the widest variety of diet we can possibly eat. And I was horrified to read, you know, some years ago that, you know, modern Western man gets 70% of his calories from 4 foods, which I think is, you know, well, you can guess it's grains, it's sugar, it's potato, it's rice. So it's a high-fat, high-fiber diet. And I know some people worry that they might become, you know, constipated on the diet, but not so. Okay, then of course, you know, fats and oils are essential fuels. And the fact of the matter is that in nature, you know, there is no such thing as a bad fat. In nature, all fats and all oils are good. And the key point is it's the saturated fats, which are the tough fats. So I illustrate that by sticking my arm out. That's a saturated fat. It has a straight carbon backbone. It's completely saturated with hydrogen ions, and it's a short, tough molecule. That's what you cook with. I was delighted to read that the fish and chip shop that won the best chips of the year cook in beef fat. It's delicious. So always cook with saturated fats. That's animal fats, goose fat, coconut oil, butter if you can tolerate it, because it's a tough fat. And then we have unsaturated fats, and they're called unsaturated because there's a hydrogen ion missing. And if there's a hydrogen ion missing, you're going to get a kink. So You're going to get a kink there at the omega-3 position. You're going to get a kink there at the omega-6 position. You're going to get a kink there at the omega-9 position. They're boomerang shaped, and they are essential for cell membrane function, and they add a certain frequency of vibrancy to those cell membranes. John McLaren Howard did some extraordinary studies using antibody fluorescence studies, where you could actually see these kinky boomerang shaped molecules on the surface of mitochondria and all cell membranes. We run into problems when we heat those fats or we hydrogenate them, because I have illustrated those unsaturated fats with my left arm quite correctly, because in nature they are all cis fats, they're all left-handed. But if you heat them or hydrogenate them, they turn into right-handed trans fats, and they do not fit biological enzyme systems, and they are extremely damaging. So the key here is, do not use margarines. Do not cook with oils. It's the most dangerous thing you can do. My daughter, when she was at this local school, her best friend, parents ran the local fish and chip shop. And of course, nosy me. Ask them how often they change the oil. Well, first of all, they cook with oil. So she kind of politely asked them once a year. So. Okay, so they're the rules of the game, which I've said. I'm not going to repeat. Only cook with saturated fats. It's much more delicious. It's very safe. And here, one of my lovely patients sent me this, which illustrates the point perfectly. They're happy because they eat lard. Okay, now, as I mentioned, carbohydrates, yes, they are essential for human biochemistry. Carbohydrates, sugars are 6 carbon sugars, but they can be broken down into 5 carbon sugars, which are the raw material from which we make nucleotides for RNA, for DNA, and of course to make ATP. So sugars are an essential part of life. And that's not a no sugar diet. In fact, sugar is such a vital biochemical necessity that the body has learned to make it from protein. So if the body is completely sugar deprived and carbohydrate deprived, then it will use gluconeogenesis in order to generate sugars from proteins. So yes, sugars are essential, but we're swamping ourselves with the wretched stuff, and that's why it's so awful. It's also needed for glucuronidation, which is a major detox pathway in the liver. And if you cannot glucuronide with sugars, that is a congenital abnormality. It's called Gilbert syndrome, or I should correctly pronounce it Gilbert, because he was a Frenchman. And what he noticed, Gilbert, is that his patients were much more prone to fatigue. There was a study in the Journal of Nutritional Medicine that Damien was editor for decades, looking at fatigue syndromes in patients with Gilbert syndrome. Voila. And in fact, as some of you knew, I developed interest in the farmers who'd been poisoned by organophosphate sheep dips, and organophosphates inhibit oxidative phosphorylation for obvious biochemical reasons. And 30% of those had Gilbert syndrome, i.e. they were slow detoxifiers. And this was confirmed by a lovely study done in the north by Professor Nicola Cherry, who looked at the ability of farmers to detox. And essentially about a third were slow detoxifiers, and they were the patients who were prone to getting chronic organophosphate poisoning because they couldn't excrete their organophosphates sufficiently. Now, so when I have a patient who has Gilbert syndrome, I routinely give them glutathione, 250 to 500 milligrams a day, because that supports the other detox pathway in the liver and is very helpful. In fact, I'm coming to the view that because we all live in such a toxic world, and you can do your very best, but you're going to be poisoned. When doing fat biopsies and blood tests, I've never seen a normal test. And a normal test is no levels of pesticides, no levels of volatile organic compounds. And am I rabbiting on too long?
5 minutes.
Okay. So detoxification is really important. Okay, eat seasonally for variety, discuss that. So I'm not going to repeat that. And Douglas Adams, another one of my favorite authors, it's complicated, the microbiome, and it's so complicated we just, don't know enough about it. But it's the old story. What did primitive man do? He ate seasonally because he had to. voila. Oh, crumbs, I'm going to have to race on now. Bone broth, fantastic stuff. All the raw material for connective tissue. Help your gut to digest by chewing. The business, I mean, we tend to eat a soft diet, and nowhere is that worse in our children who eat soft foods and end up with rotten teeth, undershot jaws, dental problems, dee-da. Give your children tough foods, and you should chew your foods, because the business of chewing starts the whole business of digestion in the mouth. And saliva does not just contain amylase, it also contains proteases and lipases, and that stimulates gut motility, acid secretion in the there we go, there it all is. So that's what chewing does as well. And then timing, did primitive man get 3 meals a day? I don't think so. And primitive man would be much more lion-like, is my guess, and he'd have had days of feasting and days of fasting. So the gentleman over there, I think, asked, what's the optimal amount of feasting and fasting? And the answer is, I don't know. But once you are keto adapted, fasting is easy. It's a pleasure to do. And, I usually have 1 day a week when I don't eat anything. And guess what? I don't have to shop. I don't have to cook. I don't have to wash up. It's fine. Okay, that's the upper fermenting gut, which we've talked about. Those are the raw materials that mitochondria, I think, need daily to work. And this is in order of importance. And you can read just as much as I can. But the vegetarians almost invariably are going to be deficient in CoQ10, in vitamin B3, and acetyl L-carnitine, and probably B12 as well. That's why being vegetarian or vegan is a major risk factor for chronic fatigue syndrome. Okay, so what commonly inhibits mitochondria? Again, when I was working with having an intellectual love affair with John McLaren Howard, he developed translocated protein function tests. And these are things that came up so commonly as blocking mitochondria. Lactic acid, hence the importance of PACE activity, importantly. Products of the fermenting gut, we've talked about. Diamino compounds, dyes. It's astonishing how dyes come up so often on translocated protein. Hair dyes, food dyes, pharmaceutical dyes. And then all these other compounds there. Malondialdehyde is symptomatic of poor antioxidant status. And then when it comes to the ME patient problem, that's why my book, The Infection Game, was derived. And if you have ME and you're asking yourself, which infection, that's a reasonable start. So having done all that to mitochondria, having got them in a fit state, so they've got the raw materials, they've got the right fuel, and they're not blocked, we then have to sort out the control mechanisms. And that's the thyroid accelerator pedal and the adrenal gearbox. Now, thankfully, we now have the tools of trade where you can do that yourself. You do not need a doctor. And in fact, my experience with treating thyroid problems is doctors are positively obstructive. Okay, and we touched upon the circadian, just tell me shut up and I'll just shut up then. We touched upon, because I expect all these people running on carbs need their lunch. I don't, but never mind. We touched upon the circadian rhythm earlier. And again, as I mentioned in answer to the question, the chronic fatigue syndrome ME patients, they're owls. Typically they can't get off to sleep until midnight, and they can't get out of bed until 8, 9, 10 o'clock in the morning. And for some of them, they're absolutely freewheeling throughout. And you can read, so I'm not going to. We need light. We need full spectrum light by day. We need melatonin. We need thyroid hormones, and we need adrenal hormones for a good circadian rhythm. And that is absolutely vital. Hypothyroidism is one of the worst diagnosed conditions in the Western world today. Not my words, but those consultant endocrinologists, Kenneth Blanchard. It's very common. And the biggest mistake of doctors is to rely on TSH as the sole method of diagnosing and treating hypothyroidism. And as a result, they are consigning hundreds of thousands, nay, probably millions of people, especially women, to a lifetime of misery. And to rely on a TSH is bad medicine. Yes, thyroid function tests, blood tests are helpful, because the last thing you want to do is to treat somebody who's already got an overactive thyroid. But underactive thyroid massively outnumbers the case of overactive thyroid. The other reason to do it is to make sure that there's biochemical scope for trial of thyroid hormones, and that gives us the tests.
Do you want to go straight to the commercial and then wind up?
Yep.
Oh, you did the commercial already, didn't you?
Did I?
Yeah, you had the books.
Oh, yeah. But all my information is on my website. You don't have to buy the books. You'll be pleased to hear it's all there somewhere. So, and then so we have to fine tune the orchestra, and I'm not going to go all that, but a very useful technique is using core temperatures. That information is free on my website. But essentially, thyroid hormones are responsible for our average core temperature, and adrenal hormones are responsible for the fluctuations. Now you get one of these, core temperature, you measure your temperature very quickly and easily. It takes a flash of a second. It's what they're all using, to diagnose COVID. And the point here is that if your energy delivery mechanisms are all working fine, you will have a normal temperature. If any one of them is going slow, your core temperature will be subnormal. So this is again why you can only judge the thyroid stuff having got the diet, the mitochondrial stuff and all else in place first. Otherwise you're going to get, results that don't just reflect thyroid function. And I find core temperatures very helpful. Guess what? Why? Because you can do it yourself. And that's how I use the glandulars. And because I keep returning to these regimes over and over and over again, and even I don't get bored talking about them. I'm painfully aware that many people in this audience have heard me rattle on before, and I hope are quietly dozing off at the back. But even I don't get bored of these because they're so important. When people get it right, we then have the wonderful satisfaction of watching them walk their own path to recovery, and that's what medicine's all about. Thank you.
Well, they are, if you like. It's got a few questions. Yeah. Do you want to come? Okay, fine. So we've got a few questions off the Zoom first. Some of them are slightly similar. Number one, should you do a ketogenic diet if you're hypothyroid or in fact Hashimoto's?
If your thyroid has been corrected, then absolutely yes. But as I mentioned earlier, a very good clue, there are some symptoms and signs that are peculiar to hypothyroidism. One is a slow pulse. If you're not an elite athlete and your pulse in the 50s or 60s, almost certainly you're hypothyroid. But another very useful clue is what I call ketogenic hypoglycemia. So you do the ketogenic diet and you should slip effortlessly into ketones because anybody does. Everybody will get into ketosis if you cut out carbohydrates for a few days, cut them out properly. But if you still feel hypoglycemic and craving funny, that is because you are fat burning with adrenaline. We need thyroid hormones to fat burn. And I call that ketogenic hypoglycemia. So if you feel dreadful despite doing a keto diet because you haven't got the thyroid fat burns, then at that point you start looking at the thyroid issues.
Great. Similarly, can a type 1 diabetic follow a PK diet?
Absolutely. A type 1 diabetic can. And we have the wonderful example of Dr. Ian Lane, GP in Winchester, who is a type 1 diabetic. Now, he has been keto adapted for years. He's also an athlete. He did a 5-day fast, and together with Matthew Pinchant and friends, they ran 20 miles every day to Bristol, eating nothing. His insulin requirement was unchanged. His blood sugars were unchanged. He was running on ketones. A ketogenic diet is the treatment for type 1 diabetes. Now, you will always need a little bit of insulin, but it'll be constant. It'll be very easy to maintain because your insulin requirements are so low. So yes, absolutely. But what I would say to any diabetic who's on medication is if you're going to do the swap to ketosis, you must get yourself continuous blood sugar monitoring like a Dexcom machine, because if the only people who get serious hypoglycemia is people on medication. So you will obviously reduce your medication. My experience is the type 2 diabetes, they can all come off their meds. There's absolutely no need for metformin, sulfonamides and all the other stuff. But the type 1 diabetics will probably need to base load with some insulin. And to do that, you've got to have a Dexcom machine and you've got to do it properly. In the policy in the NHS these days, I know is all young now type 1 diabetics are routinely given these. I'm afraid the oldies aren't. The machines cost about 800 quid.
related to that, then somebody says, can you recommend a good make for a breathalyzer? I assume it's a ketone meter, obviously.
Well, they're all much for muchness. They all use the same technology, and I think the cheaper ones work as well as the expensive ones, but you've got to be somewhere near, and you've got to use it with respect as detailed.
Yeah. You know, you were saying that alcohol goes the same. Apparently, some of them you can actually fry the mechanism with alcohol. So,
I've not tried that yet.
no. Hormone-dependent cancers use fats as fuel. How would we implement a PK diet in these cases?
Well, the PK diet is the starting point to prevent and treat all cancers. And there are lots of well-documented cases, particularly of brain tumors, where the progression of the tumor has been completely halted. You know, I have a local farmer who had a malignant glioma diagnosed about 5 years ago, had all the chemotherapy, radiotherapy, until the doctor said, well, that's it. There's nothing more that can be done. You know, you've got weeks to live. Put him on a ketogenic diet, all this stuff. Here he is, 3 years down the line, still running his farm full time. Interestingly, he had his malignant glioma right there in the parietal lobe, and that's where his Bluetooth device lived, because that's how he was able to. And we had a fascinating conference 18 months ago, 5G, oncologists in Sweden, brain tumors increasing exponentially, and they're all occurring there on the side of the head. Draw your own conclusions.
Absolutely. Yes, so we take some from the floor. Gentleman there, there's a mic behind you.
Sorry, just one question with the ketogenic diet with cancer. Would you also, though, be looking at the glucoaminolysis pathway to reduce glutamine metabolism, as some cancers, or most cancers, will switch to glutamine, or some prefer?
I don't see, the answer is I don't see many cancer patients. It tends to be, friends. So I'm afraid I don't even look at that.
There was one other question, sorry, about ketogenic diet. If someone was having a problem with a buildup of porphyrins, like in the heme pathway, and they're put on dextrose to slow that pathway down, they wouldn't possibly maybe be able to go on a ketogenic diet. Would there be a way around that? Well,
people don't have to stay in ketosis all the time. Was primitive man in ketosis all the time? No, he wasn't. In the autumn, there was a windfall of food, and he got fat. He switched on the carbohydrate addiction gene. He tucked into fruit and nuts and seeds and probably grains, whatever, and got fat. So he wasn't in ketosis all the time either. And I think the important thing is, if you're in ketosis for most of the time, that'll do. Am I a paragon of virtue? No. Am I a gardener? Yes. What have we got at the moment? We've got sweet corn in the garden, which I can't resist. I've got potatoes in the garden, which I can't resist because they're so delicious. So yeah, at this time of year especially, I go in and out of ketosis. And so you listen to your body, and your body is intelligent. We have a protein appetite, really. We have a fat appetite. And I would just say to those patients, if you are more comfortable going in and out of ketosis, that's fine by me.
Great, thanks.
Yes, the lady here. Use the mic, please.
Very simple question. Will the ketogenic diet long-term will have a negative impact on the microbiome diversity?
No, absolutely not, because a ketogenic diet is a high fiber diet. And in a ketogenic diet, we're eating seasonally. I'm very lucky. I'm a gardener. I've got a polytunnel. I just eat what's in season. And my guess is, okay, I'll have a run on leeks, and my leek fermenters will flourish during the spring, and then there'll be no leeks, and they'll just go into hibernation. But they'll still be there for the next spring. So I can't see how a ketogenic diet has an adverse effect on the large bowel whatsoever. In fact, a proper paleo-ketogenic diet, which is high in fiber, will have a fabulously beneficial effect on the microbiome, because we're eating seasonally and we're eating a much greater variety of foods than otherwise.
Great. Yes, the lady here.
Has everybody noticed these are all food questions?
Can you use a ketogenic diet with someone who has a problem with their kidneys?
Absolutely. And in my ecological medicine book, I cite the case of a Gulf War veteran who was incredible. You name it, he was poisoned by it, depleted uranium, pesticides, the lot. And when he came to me, he just had 2 weeks in ITU with malignant hypertension, and had his GFR was less than 20, and he was on the waiting list for renal transplant. And he came to me and we did the standard workup, you know, the ketogenic diet, the magnesium, the B12, all the stuff I did. And by the time his number came up, his GFR was up to 35, and it then we got it up to 50. So absolutely, yes, it's a fantastic treatment for any organ failure, because ketones are the preferred fuel of those organs. With that fuel, they can heal and repair.
Brilliant. I think we're going to have to stop there, I'm afraid, because we've now got 50 minutes for lunch.